Welcome to Mum Days, a beautiful collective of mamas and experts sharing wisdom, inspiration, and life hacks to support us on this journey through the hazy days of motherhood. Welcome to this episode of the Mum Days podcast. I'm your host, Holly Lowe, and I have the privilege of chatting with Vicki Hemmett today. Vicki is a Canadian-born mama as well, and she grew up here. So this is a neat thing to talk a little bit. We have a lot of American guests and people from all around the world. So I always love it when we get our Canadians on here and local,
For sure.
local womenpreneurs. And we're going to talk today. Our whole thing we're focusing on right now is just the concept of trauma. But it has so many facets to that. So birth trauma, body trauma, emotional trauma, all the things that can build up and affect so much of our health, fertility especially, but so many other functions in our life. So that's a big overview of where we're going. So a lot of the guests that we're chatting with right now are pulling in, and I love diving into this with all of you because I'm learning so much. And you're all bringing me something really tangible and educational that I can take away with this. And I hope our guests, I know our guests are feeling the same once we have these combos and they've listened to some of our other episodes. I've heard the same kind of feedback, even from the experts, that we're all learning, and I like that. So you are going to talk a little bit about a lot about pelvic floor.
A lot about pelvic health, yeah.
Yes, and this is a big part of healing and a big part of what we do as women as we go through birth and all the different things that happen in our bodies. So I'm going to let you give us the story of how you got here and what it is that you do.
Okay, perfect. Well, thank you so much for having me. And I love, the Canadian connection. And I have to tell you that, a mutual friend, kind of brought us together. And I'm so grateful for, that connection. And I just think what you're doing is fantastic. And just providing this, forum for women in general and mamas. And I think, to your point, like weaving in all of these different aspects of healing is so important. And most people will either experience a lot of this trauma related and non-trauma related, kind of physicality showing up. And no one really talks about it, and I kind of specialize in pelvic floor health, and we kind of describe it as a silent epidemic, which I think could probably be used to describe many of these dysfunctions that a lot of mothers are feeling, and just kind of like brush off as normal or like a normal outcome for postnatal and even prenatal and just kind of like women's healthcare in general. It's like, oh well, I had a baby, so this is just normal, but it really isn't, and it's a silent epidemic. So, I'm really hoping to, our kind of tagline is like blowing the whistle on this silent epidemic, and then just to validate for women what really is happening with their bodies, to identify it, to diagnose it, and to like really bring in these conservative, easy treatments that will provide these lifelong empowerment strategies once you get healing, that you can like really have these, optimal lives, despite, some of these issues that can be really reversed.
Yeah, absolutely. So, But you didn't start with this. You didn't start in public health, did you?
Oh my gosh, no.
Oh.
So I was born and raised in little old Chatham, Ontario, and I love Chatham. Most of my family actually are still there. A lot of my friends, kind of actually have settled there. And so just outside of COVID, before COVID, I would go and visit and, just really get that same kind of like butterfly feelings when I was going down like my road. And it really truly just does feel like home. But I always knew I wanted to get into healthcare at some aspect. My dad is a dentist. My mom was a nurse. So I was kind of like looking more into that healthcare realm, and more or less, I would say, stumbled upon chiropractic in my third year at Queen's. So I went to Queen's University, and I went into my Bachelor of Physical Health and Education with a combined science degree, a BSc degree. And I kind of was looking at pre-med, but really medical school just didn't resonate with me for some reason. I just felt like it just was not my thing. And I was looking into PT and massage therapy. And then I heard a chiropractor talk. I had never been to a chiropractor, never really been exposed as
Okay.
a kid or anything, never heard anything about it. But when I heard him talk about, how they're bringing in kind of like the mind, the body, and then just kind of like this preventative nature, I was like, oh gosh, that makes a lot of sense.
Yeah.
So, fast forward, went to National University of Health Sciences in near Chicago in Lombard, Illinois. So that's the same, kind of 4-year program as a medical degree. We just go through the summertime, so it's a 10 trimester thing. And I met and married my husband, who was in my class, and he was from Vermont. And we decided to move back to Vermont in 2002, and we bought a really busy orthopedic chiropractic clinic.
Mm,
So it was very much, kind of high volume, high paced. And he was a gentleman who owned the practice, and it was like really, really busy. And it was great because it provided me a lot of exposure to adjusting and really kind of bringing up my clinical skills and diagnosing. But it just didn't feel like it was like it kind of like felt my burning desire. So I knew I always wanted to work with women. And so what I did is just kind of schlepped out to all the OBGYNs in the area and say, look, we could have this collaborative relationship.
mm.
And only one, practice was really kind of interested. So we kind of like to fast forward this a little bit. We worked collaboratively for about 5 years. And then at that 5-year mark, they are amazing practice. They're the biggest OBGYN practice in Vermont,
Wow.
and they deliver more babies than the hospital system. So
Wow.
they're awesome.
Yeah.
And they have like the lowest intervention rate
Mhm.
also. They're really, really good. So it's a collection of nurse practitioners and midwives and OBGYNs. They're fabulous,
Awesome.
fabulous women. Yep. And so they had this vision of bringing an integrative healthcare building, and they wanted to work independently. So they invited us to join into the practice, and that was in 2008. And so we have now a primary care naturopath based office. We have an acupuncturist. We have the largest OBGYN clinic. And then, of course, we have our Hemet Health there,
Oh
which
my
is
gosh, that sounds like a dream.
a dream. It's a
I'm
dream.
moving to Vermont.
I know it's such a wonderful
Wow.
integrated health building, and that was
That's
what I
how it
really
should be.
it was designed for, right? So we each kind of
Yeah.
bring our own certain strengths,
Love it.
and most patients come in and they're like, "Oh, I can get my primary care here. I can get here." It's just
Yes.
such a beautiful setup.
It actually reminds me a lot of, sorry to interrupt you. It reminds
You're
me
not
a
interrupting.
lot of Germany. So
Okay.
we've been to Germany and for our business, and
Hmm.
talking to the practitioners, and I've trained, midwives and doulas and so on in other parts of Europe. That's
Okay.
very much the European model of healthcare is you just go down the
Yes.
hallway and you can see a naturopath, and then you go down the hallway, you get acupuncture, you go see your family doctor. They're going to
Yes.
suggest massage down the other hall, like it's just there. It's part of what they do.
Well, and I think what, kind of how we describe it is like it's a patient-centered model of care,
Yeah.
right? So the patient's in the middle and you think of a spoke of a wheel, right? And you may need to see your OBGYN if you have like a raging, UTI that requires antibiotics, right? But you also probably have some pelvic floor dysfunction and spasm around that. So then you come and see the primary care, or excuse me, see like me, the pelvic floor, and then you need to reestablish that real healthy probiotic flora, so you go see your naturopath. There's some awesome,
I love
so it's like for that one condition, everybody has their own kind of impact on the patient, and it really is a wonderful model of care. So I that's our first baby and I love it. And so in 2008 they were saying it would be great to have an in-house pelvic floor provider,
it.
and at the time, I actually had zero, exposure to that as a chiropractor. And, and at the time, I actually had 2 kids myself, and I didn't really know about that at all.
Right.
And so, after some research, I said, geez, this sounds like a musculoskeletal issue, which is 100% in my wheelhouse. And I was curious, right? Because I knew the overlap with the prenatal, postnatal realm. And so I went to a seminar. I think I was the first chiropractor because typically the PTs like really dominate
Yeah.
the scope of pelvic floor work, which I think is great. And so they said, "Wow, you're in DC and you want to do this?" I was like, "I just want to learn a little bit about it."
Yeah.
And Holly, I have to tell you, so in there we learned a lot about anatomy, and then we did an intravaginal exam to kind of understand how to treat. And as soon as I did my first intravaginal pelvic floor exam, it was like that was my massive like light bulb moment. That was
Wow.
like my Oprah aha moment. I was like, oh my God, I totally 100% everything came into clarity in that exact moment. I can remember it. It was like one
Wow.
of those moments in your life that you remember. And I can, on one hand, it's like the birth of your children, like when I said I do to my husband, and like that moment was right up there with like I
Yeah.
knew that this was gonna shift big time for
Mm.
me. And so, and I hate to be dramatic, but like really, it totally has shaped the
Yeah.
way, the way I practice and ultimately where we are right now in life. It really was attributable to that moment.
Right.
And so what I realized was that, you know, from a PT perspective, it's very much an external biofeedback, like that kind of is industry standard on how to identify and treat these pelvic floor conditions, which I think is, I think it's great. But I also felt like as a chiropractor who works primarily with certainly manual adjusting, but like 90% of the time I'm doing soft tissue release techniques.
Right.
I just felt extremely limited by not having any, kind of manual therapeutics to offer my patients. And it
Mm.
also just didn't, to be perfectly clear, I wasn't even sure I was going to pursue this. And it was
Right.
a couple $1,000s. I was like, I don't even know if I'm going to like invest in this because I didn't even know if I was going to pursue it. So I was like, I think I can manually, just kind of
Right.
understand this as opposed, just give verbal feedback versus what's digitally kind of like press,
Yeah.
kind of onto the screen. And so, to that end, I also became slightly obsessed, right? So we are very, evidence based in our practice. I think that that's very important to look at like all of the science behind what has been in the profession and like looking to future and what that looks like. So I kind of did like a deep dive and it was like Pandora's box. So you just kind of like open one thing and another and another and another. And it was super exciting for me to be able to have the confidence of my patients, the confidence of the referring providers, to bring them to me. And it was just something that was very intuitive for me. And so what I did in the absence of like this manual technique, I just kind of developed and took these concepts that I was doing externally and just kind of like created something that was missing in the pelvic floor realm. And I just kind of created what I now have patented is the kind of pelvic power release is what I call it, and combine that with external manual muscle work, combine that with the chiropractic manipulation, because all, if you think about it again, this kind of
Yeah.
goes back to the science, all of the pelvic floor muscles attach to those bony components of the pelvis,
Makes
which,
total sense. Yeah.
gosh, anatomically, neurologically, everything. So the hips, the SI joints, the lumbopelvic region. I was getting these anecdotal, really amazing, quick results with these women, and to back that up with our science, it was showing that the manipulation also had a huge impact neurologically and physiologically to the muscular
Right.
baseline. Yeah, it was very, very exciting. So that's kind of how I got into it. And now, my practice is at least 30 to 50% pelvic floor conditions. And it's, I don't know how much you want me to kind of go into like where I'm at now. So, you know, um, doing a lot of hustle, doing a lot of, mama, seeing a lot of hats in my world. So like I said, I have 3 kids. They are now just barely 11. His birthday was on. My son is 11. His birthday was on Saturday, and he's a real sporty kid. He's really awesome. And then I have a 13-year-old girl who's in 8th grade, and a 15-year-old girl who is in 10th
Wow.
grade.
Mm.
So I feel really blessed that I have a great partner in marriage and in life and business, that we really, split everything 50-50. So he would go to work work for one day, and then I would go to work for one day, and back and
Mhm.
forth. And I know that I just actually realized that you homeschool your kids, and we also, for the past 4 years, we're homeschooling our kids at
Oh,
this.
wow. Yeah.
So
When you head into those teen years, right? It changes a bit.
it changes big time, like, not only from, what I think the kids need in terms of just kind of, like, exposing them, but, like, content-wise, it's like, "Whoa, okay, I need to really, like, get myself in order," but I
You
like
actually have
that.
to wear a teacher hat for,
Yes.
where you can get away with it with the little guys with their workbooks and all that. But yeah, I have a 13-year-old in grade 8, and all of a sudden
Okay.
I'm like, oh,
I know
I'm
these
so
cons
next year.
yes. But on the flip side, like my sixth grader who's doing US history, of course, here, it's like, ooh, I didn't really know that. And I kind of am learning along right with them, which
I
is
love it.
like such a blessing. But we actually, the girls are, we enrolled them into public school this year. So and we also moved. So I'll kind of go into that too. So we moved from Vermont to Naples, Florida, which is where I am right
Oh,
now.
wow.
Yeah, and
I
so
love Naples. I love it.
Naples is like this little slice of perfection in our
Yes,
minds.
it
It hits all
is.
of our check boxes, and
Yeah.
we moved in July of 2000, just this year.
Yeah.
And we've been in business for about 19 years, right? So
Wow.
Dr. Eric and I were thinking, what are we going to do? We always really wanted to retire here, and COVID really, like everybody, kind of shifted our worlds a little bit
Yeah.
and put everything in perspective. And we thought, why are we waiting? And so what we have now is a wonderful, like capable, like fantastic team in Vermont. And so we have a one associate who's managing the bulk of the chiropractic patients, and we also work collaboratively with two licensed athletic trainers. So
Awesome.
we have this like rehab team that is great. They work all of our orthopedic patients, but they really bring in this pelvic floor work too. And they're each certified, which is so cool, in rectus diastasis management and postnatal
Yes.
workup, because of course we have 80 to 90% of our patients are medically are referrals from medical docs, and the
Mm,
bulk of those are female patients, either prenatal or postnatal.
right.
And we just feel like from a chiropractic standpoint, I have a lot to offer these patients, but it's not really, I'm not, I feel like truly I can't do everything. And I don't, that's just the rehab piece is just not my strength,
Mhm.
but it absolutely is the rehab team that we have down there. They are amazing to bring in the diaphragmatic breathing, the rectus diastasis management with TA activation. And I will tell you that this is also something that I have learned with the pelvic floor work, is that when we talk about the core, I think the huge missing piece is this pelvic floor. It's the bottom of the core, right? So the core for sure, like, is this transverse abdominis, that muscle that runs underneath these pretty six-pack muscles. And I tell my ladies all the time, it's like, yes, these six-pack muscles are like awesome, but that's not the one we're actually targeting.
That's it.
Underneath that transverse abdominis is that, like, it's like a Home Depot brace, that these back braces, it looks identically to that. The muscle fibers run circumferentially around the spine in the front. That's the one that we're targeting. But it's like having an open cylinder without a top and bottom. So the top is the transverse, the diaphragm, and the bottom is this pelvic floor. So, I refer patients down to my rehab team once the pelvic floor is really rehabbed, and the spastic component is kind of like taken away, and I teach women how to do an effective kind of Kegel or pelvic floor contraction exercise, because statistically speaking, these women are not, to their best effort. They
Yeah,
don't really understand how to do an efficient or effective pelvic floor contraction. And so they're spending all of this time and energy into this, and it's just not effective. And it's so
absolutely.
frustrating, right? It's like,
Yeah,
oh,
yeah.
I'm doing
Well,
this.
I remember that happened to me. That was my
Okay.
first time. It was actually my first time at therapeutic Pilates.
Okay.
And
Yes.
I had pretty severe diastasis, and I
Mhm.
explained that to her, and we had kind of a one-on-one session to look at everything, so she knew how to modify and help me through the classes.
Mhm.
And I remember her coming right over to me during like a group class, and she
Yeah.
took her finger, and I was like, "Where are you going?" And she poked like right down in my pubic bone
Oh
almost.
boy.
And
Okay.
she asked me first. She's like, "Do you have
Yeah,
permission to
first.
point this out?" And I'm like, "Yeah." She goes, this is where you're contracting, not here. And I'm like, I knew this in my head, but to
Yeah.
feel that connection, it was like, oh. And she went and gave her this great little talk. And she's just I mean, I say just, they're
Yeah.
brilliant where I go, but little like pelvic floor, pep
Mhm.
talk, and said, I guarantee all you ladies in this class, they're all women, all you ladies in the class have no idea how to do Kegels correctly.
Yes.
I'm going to teach you them right before we leave the class. And it was like
Oh,
mind blowing moment,
mind blowing.
right?
Mhm.
I love it. I love it.
Yeah, it's so, so important. And so we're very sensitive to that in our clinic where it's like, I just don't want to send you down to rehab because I want to make sure that that A, and I'm going to get into this in a sec, but A, you don't have like a spastic component in your pelvic floor. So you don't want to actually be doing Kegels
Yeah.
yet, and that you're actually doing them correctly.
Yeah.
So, our rehab team is amazing. We have some fabulous front end, back end to our Helmet Health Clinic in Vermont. And so what is happening, I'm actually flying up now, up north to once a month for a week to treat patients, to kind of
Amazing.
continue with that collaborative networking, to support our practice up there. So far it's been working beautifully,
Oh, I love it.
and so it's really great. But yeah, I think this is a really good time to really talk about that pelvic floor misconception too.
Yeah.
Is that when people think about pelvic floor dysfunction, in my experience, is that most people think, oh, weak pelvic floor muscles, organ prolapse, peeing my pants, not being able to jump on the trampoline
Yeah.
with my kids, tee hee, right? And while that's certainly some portion of pelvic floor dysfunction, it's just like this little snippet of this
Yeah.
like broad-based range of dysfunctions within women's healthcare. And I do want to mention too, like, men suffer from pelvic floor dysfunction as well, and that's a big deal. It's just not what I treat, so I don't have any expertise in it, but I encourage, if ladies have their partners or husbands or brothers or friends who have male pelvic floor dysfunction, there are really great providers out there. So I'd encourage, just
Totally.
as much as I encourage women to go seek out care, like men to do that too. But it's just not anything that I have any experience in.
Well, when I start the Dad Days podcast, then we'll
There we go. Yeah, I'll find someone. I'll
I
find
know
my
I
male counterpart. I know he exists somewhere.
he does. I don't know. I don't know if he'd be talked into that one or not. But
Oh my gosh.
I'm gonna
Yes.
I'm gonna pause for 1 second, and
Will
we're gonna
do.
be back. And I don't go anywhere, everybody, because I'm gonna pick your brain a little bit about. I want to know symptom wise, how do we know if we need this kind of help? I mean, I think everyone does, but that's my
Yep.
opinion.
I
Um,
do too.
and yeah, like when should you be thinking about treatment? And really, I want to touch on C-section just briefly
Oh
too.
yeah.
I know I get asked that a lot, so we'll be
Me
right back.
too. Okay. Yep.
Have you ever felt overwhelmed or confused by the world of natural wellness and essential oils? We're here to help. At Oil Babies, we want to make it simple, safe, and easy for you to have all that knowledge at your fingertips and the tools to take care of your family. Check out our Back to Basics program on our website or check out the link for more info. All right, let's get back at it. So I want to jump into the C-section question first. Is that
Okay.
okay if we do that? Because you
Yeah,
mentioned
sure.
about that band and about how the muscles run, and
Mhm.
it's interesting because when I was training to be a labor doula, we're nowhere near trained as a midwife. Let's give that distinction.
Yes, I understand. Uh-huh.
Yeah, a lot of people make that, misunderstanding. Even my listeners will message me with questions that are well beyond my field of expertise, and
Sure.
I'm referring them on.
Yeah.
But we did. Over the years, 18 years of being at births and listening to OBs and learning from the nurses,
Mhm.
you and therapists and whatnot. I've just collected all the good information because I love it. I soak it all up.
Yeah.
But C-section trauma, in a sense, and that muscle trauma that happens, and that rebuilding that has to take place, or
Mhm.
start to, and things like that, VBACs, and doing vaginal births after a cesarean.
Yep.
From your perspective, what's happening in there after,
Mhm.
even just technically speaking, what's happening in our body after a C-section, and how can we help with that?
Yeah, for sure. So full disclosure, I've had 3 C-sections personally myself.
Yeah.
The first 2 were just not at all planned, and the third one was planned, and that was the only time my little stinker decided to come into this world 2.5 weeks early. And so I had to have more of like a very quick
Yeah.
transition into that C-section. I'm sensitive, and I empathetic to women who
Yeah.
have been through C-sections, especially after, like, for me, it was like 24 hours of labor and then ended in a C-section.
Yeah.
So, to your point, unfortunately, having a C-section does not, protect you from any pelvic floor dysfunction. And if you think about it, and from many levels, right? So just from the first level of just being a pregnant mama, right? So this baby who, is from 4 to 10 pounds, give or take, just kind of rests in your pelvic floor for 9 to 10 months. And with that, you get those hormonal changes, right? So you get this relaxin, and the relaxin only really, this is also a misconception. The relaxin works on your ligaments, but not your muscles,
Oh,
which is so interesting. So
I
it's
didn't know
only
that.
so
Yeah.
it's only targeted to ligaments, right? So that is why you feel like loosey goosey in all your joints, because the
Right.
ligaments are soft tissue structures that attach bone to bone to create that stability within the joint. So you feel kind of
Mm,
loosey goosey. But the muscles they don't have any receptors for relaxin. So the muscles are just detecting this loosey goosey nature of the muscles, which is, of the joints, right? So what do? They are actually spasming in
ah,
for stabilization,
counteracting it. Yeah.
counteracting it.
Wow.
So what's really from a chiropractic standpoint, this is how we teach our prenatal women, is that not only are we going to be, we have to target the muscular structure, especially this piriformis muscle, which is like the kind of the target muscle in the rear, the backside, because it attaches on the inside portion of the sacrum and then all the way over to the greater trochanter of the femur, which crosses the hip. So in
Mm,
the pelvis, that's the one that engages to stabilize not only the SI joint, but the hip, that are both kind of naturally, kind of widening, which is what we want to happen. But we just want to keep it balanced with appropriate muscle engagement, which is why we send them down to rehab. So you have a good idea of how to do that.
yeah.
Um, but we also kind of work with, muscle release techniques, and then adjusting where we need to adjust. But kind of going a little bit off course. But for the relaxin port, so when you are pregnant, that's going to impact your pelvic floor, because all of the muscles that create this like beautiful functioning pelvic floor attached to that pelvic rim. So they are going to be influenced
Right.
by way of being pregnant, by by relaxin. So that in itself is a reason to have a pelvic floor examination. 6 weeks or whenever you're cleared by your OBGYN provider postnatally, just to kind of see where you're at with
Yeah.
function. But yes, to your point, absolutely. The access point suprapubically, with the incision, you absolutely have to go through. Not only you're going through skin, adipose, and like several layers of this muscular structure, you're also kind of like really, disrupting the fascial connections.
Right.
And this fascia is what I kind of describe it as like saran wrap in your body.
Yeah.
So it's like this, like really like glidey material that's like strong, but like interweaves between layers of muscle, from top to bottom, and, like inside to outside. So it's like, it really helps the muscles function well because they can kind of glide between each other. But with any kind of, kind of surgical procedure, you're going to get this reaction of adhesion, scar tissue, just with that. So really, really important to identify that, because then you're not going to have a really good activation for this TA, right? Because we're kind of knitting that TA together in midline, and that's going to be disrupted, A, because physically it was cut, but B, because there's going to be some scar tissue there. So your rehab therapist really should be doing, our rehab therapist do Graston work. So it's like this instrument assisted, really light kind of effleurage almost, to kind of
Yeah.
like get some movement within that scar.
Yeah.
When it is, capable to handle that, and really kind of decrease the amount of scar tissue that gets built up, so you can have that engagement. And it will absolutely affect the function of the pelvic floor because that fascial layer kind of helps the support system within the pelvic floor. So C-sections, absolutely, you need to be in the even in the absence of symptoms, which we'll talk about Holly in a minute.
Mhm.
Even in the absence of symptoms, to be able to make that connection because there is, some potential nerve damage that happens with this. So there's, and most women who have a C-section either have, temporary or permanent, kind of skin alteration because their nerves are, just have been damaged. And so that ability to have that mind body connection with the pelvic floor may be altered because there's that neurological disruption. So that's really important to identify too.
Yeah, I remember in when I used to teach prenatal classes, we had this. It was done with foam, just the fun foam
Hmm.
paper. I don't know
Yep.
if you've seen these, all the layers that get cut through in a C-section.
Yes.
Yeah, and we actually had it was Saran wrap. That was the
Oh,
it
oh,
showed
no
the
way.
fascia. Yeah,
Okay.
like so
Oh,
all
I
the
want to
different
have one
layers.
of those things.
Yeah, well, and I remember one of our clients coming back, probably a couple months later for like
Mhm.
our little reunion class we did with the
Yeah.
baby. And she said to me, I could not, she ended up with a planned C section. We did no,
Okay.
the baby was a frank breech. There was nothing moving, and that was that.
Mhm.
So, but she said, I knew going in that I wanted this set up. So she actually did like a 6 week, like made her appointment ahead of time with a
Love it.
therapist and did all of this, and she was great advertising for them because she just went
Yes.
and said, like, the amount of pressure that was relieved in my, even in what she felt in her abdomen and her skin,
Mhm.
and just
Yes.
what we were talking about, just having some of that gentle motions through the even the superficial parts
Oh,
made
for
a
sure.
huge difference for her.
Huge
So,
difference.
yeah,
Yeah.
and when you're postpartum and you're working on a baby and you're trying to just get sleep and all
Uh,
the things that are happening, you're not gonna be thinking, "Oh my gosh, I'm so bloated still," or, "Oh my goodness,
yeah.
I can't have a bowel movement like I used to,"
Oh
or,
my gosh. Yeah.
you're not thinking that way. Yeah.
No, this fourth trimester, I think, is really where medicine in general, and
Yeah.
that's allopathic, that's CAM, that's everything, really have dropped the ball.
Yeah.
Um, and not purposefully for sure, but like it just, that's where I think, when you're pregnant, you're kind of like lofted into this like beautiful position. I remember love being pregnant because people like open
Yeah.
doors for me and smile at me. And like, it was like,
You
it
come in
felt
with
like
a baby and it's
me.
like, well, you're a woman, just snap back into it. Let's go. Right? Get on with it.
Get on with
I
it.
think that's a very like strong seated thing that has gone on for centuries, right? Just for women in
Mhm.
general.
Well,
That
and I would say
get
it's
on
a
with life.
I would say that it's very prominent in the North American culture
Yeah.
and not necessarily
Much
in other
more.
cultures because there's other cultures that are kind of honor this like 40 days postnatally and like have a lot of support from their female family members and so I think that we can
We
learn a lot
can
from
do
that and take
better. Yeah.
usage
Yeah.
from those and it's not it, I don't want to be negative about it, but it's something that we can have, providers in place to, again, validate for these women that this is okay. And this is
Yeah.
probably actually the hardest trimester out of all of them, to be
Yeah.
honest with
Well,
you.
even as a postpartum doula, I remember trying to get in with
Mhm.
local caregivers and family doctors and places like just to put a pamphlet out. And it was always a no. Like, no, 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 we don't want to promote anything you're doing. And it's like, I'm here to help. Like,
Yeah.
I'll do it for free. I don't care. It was
Yeah.
that you're right. It is a very North American thing.
Well, and I think it's super short-sighted, right?
Yeah.
And this rolls into the pelvic floor dysfunction because it's
Yeah.
like most women, let's just call an ace an ace. When you have a vaginal delivery and C-sections to an impact, like there is a muscle in your pelvic floor that stretches 250% of its resting state. And like in a healthy vaginal delivery, 15 to 30% of the time, it either partially or fully avulses from the attachment on the pubic bone. And if you think about like
That explains a
the
lot.
doesn't that explain a lot? And you think about like being in labor or I mean, which is I don't want to call it a trauma. It's a beautiful thing, but
It's heavy.
It's an Olympic event that requires a lot of physical, mental, whatever spiritual, impact and strength from this mother. And just from a musculoskeletal pelvic floor perspective, I'll kind of focus on that. But I do, appreciate all of the other components to that. But this is my specialty. Like, if you think about just someone falling off of a curb and like spraining their ankle, it's like they go through like 6 to 8 weeks of rehab to make sure that you're going to walk okay. And it's like this muscle in your vagina just stretched 250% of its natural resting state.
Yeah.
And think about like how everything has to accommodate this baby. And it is absolutely important to identify that and to appreciate that. So most women have some, urinary incontinence like immediately postpartum that, largely disappears within a week, I would say. And that's kind of an accepted kind of thing. And I think that that's okay. But what's not okay is that when it persists, and it may dial down from like, let's say 100% of the time to let's say like 20. And this is where we as women in that fourth trimester just don't have time to like recognize this as a symptom. And it's that proverbial pebble in your shoe that just kind of like will get, kind of get under your skin over months and years. And the thing is that it's never really going to get better on its own, and it's only going to
Right.
get worse.
Yeah.
And while you may just have, urinary leakage or fecal incontinence, which is also a very common thing that no one wants to talk about, but it absolutely
Yeah.
exists.
Or bowel retention. That was another one I just learned too, where if you have a prolapse in the bowel, it can actually cause issues, constipation feeling. Like just
Yes. Well,
eliminating is complicated,
well,
like
your
he's like,
body, yes.
I
Well,
was
your
so
body is like,
frustrated to figure this out. And it was my pelvic floor therapist who was like, how's that working for you? And I'm like, oh, I just figured that's just me. And she's like, was it
mhm,
always you? And I'm like, no, actually my first was a very traumatic birth. And from that
mhm,
point forward, everything kind of went downhill. And
right.
thinking, she's like, well, we can't fix that. That's a surgical thing down the road if it became a real issue. She said, but we
Mhm.
can keep it from getting worse. And
Yep.
I remember looking at her and I said, why did I not come here sooner? Right? Like I
I hear
definitely made
that
it worse.
all the
I mean,
time.
4 pregnancies later, I could have done something after the first issue.
Yes.
Yeah.
Yes.
Yeah. End
Well,
up first. If you learn anything from this, it's
yes.
worth
Well,
the
and
visit.
from a symptom standpoint, yes. I mean, constipation is, a huge marker of pelvic floor spasticity,
Yeah.
right? And this pelvic floor spasticity. So let's say you do have an organ prolapse, which is, it can be bowel, it can be vagina, it can be uterus, it can be all three at the same time.
Define
Unfortunately, our
prolapse define prolapse for us, because I know I had to look it up the first time I looked
Okay,
at
thank you. Yep. So POP or pelvic organ prolapse is super common. So it's when that organ kind of descends through the pelvic floor, right? So it descends through the vagina,
it. Right.
and there's four levels of it. So there's four grades: 1, 2, 3, and 4. So grades 1 and 2 really are. And they kind of measure it by like almost like the length of your fingernail, just to give you an idea of like what that looks like.
Yeah.
So sometimes you can have a grade 1 and you can kind of visualize. Some people say it just does not look the same down there,
Yeah.
and it just seems,
Or during intercourse, like
or
when
during
you're having
intercourse,
sex and suddenly you're like, I
100%.
feel like I have to pee every time right?
Hmm.
Or I feel
Or there's
pressure in my bowel or my bottom every time. Yeah.
it's painful, or there's something in the way, or it just looks or feels different, which
Yeah.
is, relatively common. So
Yeah.
usually, like a grade 1 or 2 really respond well to conservative management, where it doesn't really need to have anything, more invasive to correct. When you get to 3 and 4, for sure, like 4 is a surgical repair, 3 is kind of like depending on your lifestyle and your age and that kind of thing. And that's when we work collaboratively, of course, with the OBGYN and the surgical team. But yeah, so that's kind of, it's grades 1 through 4 organ prolapse, which we have to remember will, we can impact and we can reverse to an extent
Yeah.
based on pelvic floor health and education and work.
Yeah.
So I would say like 99% of the patients that I see are referred by their OBGYNs, because I want to make sure that there's no visceral complaints that are, kind of driving that. So we're ruling out, I see patients a lot of times who have endometriosis. That's not a
Mhm.
contraindication to what I do, but it's
Right.
a complicating factor.
Yeah.
So we just have to say your progress is going to be slower because you have this, right?
Yeah.
But, I want to make sure there's no ovarian cysts or any,
Yeah.
God forbid, any other like major things happening with the uterus or anything. So I want to make sure that that's very clear that, I'm, while patients can come see me directly, I always have communication with their OBGYN provider to make sure that we are all on the same page and that their provider knows they're coming to me and vice versa. And I share all of my updates and my clinical exam findings and diagnosis back to the referring provider. So that's really important to do.
Yeah.
And for all of you ladies looking to hop on this pelvic floor train, which I encourage you to do,
Yes.
just make sure that your pelvic floor provider is in contact with your OBGYN provider, whoever that may be, just so that there's clear communication and everybody's on the same page.
Now, does somebody, I know in Ontario in
Mhm.
particular, we don't need a doctor's referral to make an appointment with a pelvic floor therapist. Is that pretty common here? Like I was able to walk right into ours and make an
Oh,
appointment with
that's
our.
good. That's good. I can't speak to that because I don't know that,
Okay.
and I know, I mean, in
Well, it
the
could be
United
different in
States,
different.
in the US, uh, for a rehab therapist, and I may just quantify this, a rehab therapist, you do need a physician level referral into the practice. And that's an insurance based thing.
Right.
But I will quantify that. Like I know a lot of PTs have their doctorates. So I'm not
Okay.
quite sure if they're considered physicians. I know Doctor of Chiropractic, my degree, some states view that as a physician level entry, for access of care.
Right.
Some
Right.
states, which is super, like, it's just unfortunate because it's
Yeah.
very confusing for
It is
patients.
confusing. Yeah. I always just tell people it's worth calling your therapist, find a
That's
pelvic
it.
floor therapist that or get a referral,
Yeah,
call them and see what's required. If they need a doctor's note,
100%.
then go talk to your doctor. It's simple as that. Yeah.
Well, yeah, and the last thing you want is like a financial responsibility surprise at the end of care, and so you
For
just want
sure.
to make sure that everybody's on the same page and transparent, with what your, not only financial but like time, commitment is going to be with this, because it's not a one shot wonder where you get this like, here are your exercises and the expectation is that you're going to do this. It's like, no, we're a team. I'm going to help you with this, but it's going to require work on your end. But the rewards are going to be just like so incredible for your
Yeah.
lifelong, just social, emotional, all of that. You have all of what I say is we move from pain to pleasure, and from fear to freedom, and you
Absolutely.
have so much more control over your life day to day.
Yeah.
So
Yeah,
yes.
I was amazed. I have to say, like I consider myself the kind of person who, when it comes to my physical health, I've tried it all. Like if I have a problem, I am gonna march in there and seek it out. I'm gonna fix it.
Advocate.
Yeah,
Mhm.
like I will do the work. I have no problem. I'm not one who's gonna be like, hey, just give me a remedy for this and I'm off. If I
Mhm.
have to do the work, I'll do the work because I know it works. But
Yeah.
I was pleasantly surprised by and like I said, it took me 4 pregnancies before I even went and visited a pelvic floor therapist, and
Yeah.
lots of conversations with them over the years too, because I'm a firm believer in all of this.
Sure.
But it wasn't until I started chatting with someone and went, oh, and all those funny symptoms that over the years I've
Mhm.
just written off, or I remember the first thing she said to me was, well, think of your pelvic floor like a trampoline, and every baby you
Mhm.
have softens the trampoline. And I laughed because our kids have a freeform trampoline,
Yep.
and on both sides the springs have let go. And so
Oh,
I said
that's
to her,
beautiful.
I
Yes.
said to her, it reminds me of our trampoline at home.
Oh my god, like internal home. Yes.
Right? 3 kids jumping on it, it's stomach
Yeah.
damage kind of deal. And she kind of laughed. She's like, "Well, that's what we're doing. We're gonna tighten those springs back
Yeah.
up, and we're gonna help that." Yeah. And it was a
Yeah.
great visual for me, but it also made
Yeah.
me go, again,
I get
why
it.
did I wait? Right? I get it
Well,
now, but why did I wait? Like I could
mhm.
have. I mean, not like oh my gosh, why did I wait? Just like I want people to know about this.
Well, and I think again, it kind of like brings us full circle to the beginning of the conversation where it is a silent epidemic. And I think a lot of people, you know, just think of people suffering with pelvic floor dysfunction of like grandmas buying Depends and, not being able to control their bladder. And that's the end result where we don't want to be.
Yeah.
And so we really want to validate for these women. And I will say that it's not, I mean, having a baby and pregnancy is the number one epidemiological risk for pelvic floor dysfunction. But to your point of trauma, I mean, we can have physical and emotional trauma that will sit and rest in our pelvic floor. And that's really important to acknowledge. I have a lot of female athletes, who are in their teens, 20s, and even, people who are in their 40s who just choose not to have a family have pelvic floor dysfunction in the absence of pregnancies and deliveries
Well,
because of.
yeah, and we talked about that because I was a
Mhm,
competitive figure skater, and one of the first things we talked about was my landing leg, and I'm like,
mhm,
well, I'm right-handed, I land on my right leg. All my jumps, big or
mhm.
small, I'm hitting that ice full impact
Yes,
on one leg, and she's like, and I have scoliosis on top of that, so it was like,
massive
okay,
compression.
right?
Well, you think about, I mean, I'm sure that you're a very capable, skater, but think about how many times you fell in that
Oh my
darn
gosh,
ice,
yeah, yeah,
you know?
yeah,
Absolutely.
and we
So
just write it off. Athletes are bad for that.
yeah, well,
Like,
and I think
whatever.
because athletes are, strong and really have a lot of grit and determination, especially as you get these higher levels. It's like, I'm used to pain.
Yeah,
Pain is actually a good thing because it means, like a lot of people think that pain is a really good thing because
yeah,
it's like it's making me stronger and better. But, it's really important to do this. And I also want to, make this association. There's back to the point of the evidence-based medicine because there was a great study that was actually a Canadian study done in 7 orthopedic clinics. Go
yeah,
Canada.
yeah.
Yes. And what they did is they tracked low back pain
Mm,
because low back pain is like the number one cause for women. Well, number one cause for people to seek out medical care.
yeah.
And the biggest demographic for people going to seek, care for low back pain, women who are 40, between 40 and 60 years old. So
Mm,
95% of these women in these orthopedic clinics who presented with low back pain had some form of pelvic floor dysfunction.
totally
So
makes
that
sense.
is almost 100% of them.
Wow.
So within that 95%, Holly, 71% had a spastic component in this pelvic floor. So
Wow.
this also opens up, so this is like blowing my mind, right? So,
Yeah.
and this also just speaks to anecdotally what I've been seeing over the past decade, seeing hundreds and thousands of patients, is that this pelvic floor, muscular structure, fascial structure, myofascial structure is not one thing. There are different muscles that create this pelvic floor. There's deep muscles, there's superficial muscles, there's muscles that are fast twitch muscles, slow twitch muscles. So there's not just one Kegel. There's like, I teach 3 different Kegels. So there's an endurance type of a Kegel. There's a different kind of Kegel that's specific to power. And then there's a superficial fast twitch. And we really need to be able to say, okay, it's not just this levator ani. The levator ani has 5 components to it, and so there's different striations. So what there's front to back, right to
Yeah.
left. So maybe you have a spastic in one component, right? This coccygeus right-sided, which is maybe where that prolapse is coming from. So you have this spasm and this holding in that one area. So that's going to be really loud in the pelvic floor. And maybe the opposite side of the pelvic floor is loosey-goosey. So you have these like multitude of symptoms. So just because you have like 1 or 2 symptoms doesn't automatically mean that you have either a weak or a
Right.
spastic
It's
pelvic
not
floor.
as simple as just one or
It
the other.
occurs on a it occurs on a spectrum, right? And so each muscle really is what I do is I identify within each muscle what that diagnosis is for that muscle, right to left, right? So it's like looking at your entire body and saying, "Oh, you're tight." It just doesn't work that
Yeah.
way. Again, so working from a manual perspective to reduce that tension because a spastic muscle is also going to have symptoms of stress urinary incontinence because what I say is that you have this beautiful baseline or that's what we're looking for this pelvic floor, but if you're already up to the top, when you go to engage you're already at the ceiling and you're just going to burn out. So we have to get here, but where if you're weak you don't have the ability to contract to get to that baseline. So it's really important to, at any stage of a hint of pelvic floor symptoms, which can range from low back pain,
Yeah.
hip pain, and then to what we do think of pelvic floor, symptoms of prolapse, that feeling of like, oh, it feels like I have a tampon in all the time. People tell me that all the time. Or it feels like things look different. Or now I'm having pain with intercourse, but it changes with certain positions. Or it feels like I have an ovarian cyst, or I can't poop, or I poop too much, or it's my stream is different, or when I wipe my bum, things are different. Like I've heard it all over the years. And those are all signs and symptoms of pelvic floor
Yeah.
dysfunction. And just to identify it, just say, hey, this is like really outside of my comfort zone, but I need to identify it. And most pelvic floor providers, I would say, like all of them, have heard it all
That's
before.
right.
Not
That's a good point to make
You're
because
not going to be a unique
no,
case. Don't be embarrassed by it. Don't be
no,
shamed by it. Like
yeah,
most women have a pelvic floor dysfunction and just no one ever talks about it. And
yeah,
it's only going to get worse if you do
yeah.
nothing about it.
I have to tell you, so my first visit, this was really funny. It was a
Uh-huh.
complete fluke. My kids, I booked it for the day that my kids go to forest school, so I knew they'd be out of the
I
house.
love forest school.
I know we love it too. So, my 6-year-old woke up that morning telling me he didn't feel great. So I'm like, with the way everything is, he was probably
Mhm.
100% fine, no symptoms or anything. But I was
Yeah.
like, I'm not going to risk sending him, and he'll tell everyone there he's sick, right? so
Mhm.
So he came with me, and I'm like, I have my first appointment with a
Yeah.
pelvic floor therapist. So I mean, I love it. She's amazing.
Yeah.
She's like, no problem, you can come.
Yep. I say the same thing.
Right. But here's something that I think is important, and we'll kind of wrap this up with this. But I had never been. I had never even asked the question of what's involved in an appointment. I had a
Mm.
pretty good idea just based on years of listening, right? But the poor kid is sitting at the wrong end of the exam bed. Let me just say that.
Yes.
And he's on my phone. I gave him that to distract him. But all of a sudden, I notice him as we got to the internal part. He's looking, and I'm like, "You do not need to be down there, buddy. Like this is so." And we're now her and I are laughing our heads off because we're like, we just did not pay attention to it. And so she's like, "You know how to come sit up here by mom's head? What do we do with that?" And like shuffled him, and he looks up and he's like, "Yeah, that might be better."
Didn't know what I was
Like
coming
my
into today.
boys, if anything else, my boys will at least grow up with a pure appreciation for what we go through as women to have babies.
Amen.
Okay?
Amen. I think that's so important.
Yeah.
But yeah, thank you for that reminder, Holly. I
What
think
does
that
that
that's
look like
important.
in an initial exam? Just for the
Mhm.
first one, what can they expect? Should they
Yeah.
shave their legs?
So it's going to be a little bit different because again, I'm a chiropractor who does
Right.
it. So it might be a little bit different from your PT, but I suspect that your PT would probably do the same thing. So for me, as we talked about, I always do an external exam first because all of those external components impact pelvic floor. So, it's an external orthopedic exam and treatment, including the manipulation for me. And then, I always tell the patient that we're going to be doing an internal intravaginal palpation. It's of course always gloved with hypoallergenic, kind of lube. And I always reassure the patient that if they ever feel uncomfortable at any time, like they're always in control. But it's a digital manual palpation, and how I describe its sensation is that you're with your gynecological exam and your gynecological provider, most of the bimanual exams for the ovaries, the practitioner's hand is kind of turned up and kind of squishing on the belly. But what's going to happen is that the practitioner's hand will be turned 180 degrees where they're feeling the bottom. So it shouldn't be painful. If it is, the practitioner will hold off a little bit on pressure. But the idea is that we're looking for tone, we're looking for texture, we're looking for potential suturing, scar tissue. We're looking for symmetry side to side, and we're looking for function.
Right.
So it's usually kind of a palpatory, feeling for all of those muscular and myofascial components, kind of anterior to posterior on one side and then posterior to anterior on the other side. And it may feel like bowel pressure. It may feel, like there's pain. But I tell you, sometimes if there's pain, there is validation in that because the patients will say that's exactly the pain that I'm either experienced with the bowel movement or with intercourse or when I'm trying to attempt to have urination problems. That's exactly the pain. And I was like, amen.
Perfect. Found it.
We
Yeah.
found it, right?
Yeah.
And if we can reproduce it with a muscular palpation, then we can treat it,
Yeah.
right? And so there's a huge validation component to it. And like it kind of breaks the ice a little bit, and how I also say, like, once I'm where I need to be, there's no visualization. It's all just about palpation. And I also, at the same time, I have a picture, kind of on top of the patients where they can see. And so I'm teaching them
That's
how to
amazing.
identify their pelvic floor, because I think there's a disconnect between a
Yes.
lot of women. They just don't really kind of have any anatomical knowledge with pelvic floor, which I understand, but B, they just don't really feel like they have that they want to look or know about it. But I think it's important to like make that connection, like, oh, that's actually a muscular feeling, that's a muscle, that's okay. It's
It
not
makes
like an
a
organ
huge difference to visualize. It really does. Like even when you're doing
thing.
exercises then moving
Oh
forward,
yes.
to know that that muscle actually contracts this way and not
Mhm.
this way or whatever, like it does.
Totally.
Yeah, makes a big
Well, yeah, I mean, I think the more cueing that we can do, people are either visual learners or auditory learners or whatever, like palpatory, tactile learners. So I try and bring all three
yeah,
of those into just to kind of help these patients identify how to, take control of their pelvic floor, because it for a lot of people, it's a shame thing. It's a secret thing.
yeah,
All of a sudden, they're not going like, oh, there's an outdoor picnic. I can't really go because it's going to be 2 hours long, and I can't hold myself to the bathroom, and I either don't want to go to a porta potty, or I'm not. There may not be one, or oh, it's a 5 hour trip, and I'm going to be with my girlfriends, and I don't want to keep asking to go to the bathroom in the car, and that's just going to be awkward, so I'm not going to go,
yeah,
or I'm not having sex with my husband or my wife or whoever it is, because there's pain. And then all of a sudden that like just builds into something that shouldn't have to be there,
right,
and can easily be identified, easily be treated, and really bring some empowerment to these women, and
absolutely.
just bring you into this community of like, you are not alone. Everybody has this dysfunction, just no one ever talks about it. And it's okay not to talk about it with your friends if that's not comfortable, but absolutely bring it to you in the privacy of your provider, and get some acknowledgement with it, get some help with it, and just see how you're able to take control of your pelvic floor health, which will ripple out to not only how you feel, but as a mama, you are the heartbeat of the home. Let's just call in Ace and Ace. And, when mama is feeling strong and healthy and empowered and like excited and happy and glowing and like sexy, and you are allowed to feel those ways as a woman, like it is going to spread and shine in that household. And
Right.
it has to just start from you. So just I just this if I leave you with anything, it's like, just don't feel like you can't identify that. And even if you have like a really super healthy pelvic floor, like just have an exam. And it may, like, I have said to patients, like, you're spot on, girl. Like, I don't need to see you. I
Right.
think you're great. Like, this is like, you're doing them correctly, just to validate that you're doing the pelvic floor contractions correctly. And
Absolutely.
then just like, this is what you should be looking for in the future. But otherwise, like, you are spot on. I don't need to see you. Keep doing the good work.
That's amazing. Yeah, and I love that. So I personally I look at it as people use the term self-care. I know we throw it around like crazy
Yeah.
now. But my self-care is not having a bubble bath at the end of a long night, long day. That's just life. My self-care is investing in pelvic floor therapy. It's investing in
Yes.
therapeutic Pilates. It's investing in those parts of our body that
Mhm.
might not, like you said, might not maybe be causing us issues today. But when we're
Mhm.
75, do I want to be paying the price then? I talked to my mom about this too,
I
and
know.
why not take care of it now? So I'm gonna wrap it up with that. I could talk to you
Yeah.
forever. This has
Oh,
been so amazing.
likewise.
When
Likewise.
I'm in Florida, I'll be definitely looking you up. This
Oh,
is
please do.
yeah,
Absolutely.
yeah,
Yes.
absolutely. Okay, cool. Well, we're gonna wrap it up there. We'll talk again. I know we could talk more specifically about things too as we go along. So we could
Yeah.
do this
Well,
again.
thank you. Best of luck. I hope all your listeners can find someone. And, I don't really have a network, but I'm looking to maybe bring this technique to Canada in the next
Yes,
year or two.
please.
It's just like all the legal stuff that has to
I
happen, but
know.
I would love to bring it to Canada. So I will tap into your resources, Holly, at that point. But it's been lovely.
Definitely.
I'm filled with gratitude for what you do and for having me on.
Amazing. Thank you.
Okay, bye. Thanks. Take care.
Would you like to learn more? Find me on Instagram and YouTube at Mom Days Podcast.